Hi, I'm Alex, and today I'll be discussing omega-3 supplementation from krill oil for the management of pain in patients with osteoarthritis. Now, osteoarthritis is a chronic joint disorder characterized by the degeneration of cartilage and underlying bone in the joints, and this inflammation leads to pain and reduced joint function. It's the leading cause of chronic pain and disability worldwide, and pertinent to this discussion because it afflicts more than 1/3 of older adults over 65 years of age, and in women more so than men. It also carries with it a significant economic burden. For example, in the US, knee osteoarthritis patients incur almost $8,000 more in total healthcare costs compared to healthy people. Currently, there is no cure, and current treatments such as non-steroidal anti-inflammatory drugs have side effects such as causing damage to various organs. Omega-3 fatty acids, EPA and DHA, are considered essential fatty acids, meaning they cannot be made by the human body and thus must be supplied by the diet. Inflammation plays an integral role in the pathogenesis of osteoarthritis, and omega-3 derived metabolites, EPA and DHA, influence inflammation through the modulation of pro-inflammatory mediators toward a more anti-inflammatory profile. Now, in a 2018 cross-sectional study, Sybil and colleagues found that knee pain in older adults with osteoarthritis was associated with a higher omega-6 to omega-3 ratio. And omega-3 supplementation is a convenient and cost-effective method of lowering this ratio. Now, I wanted to investigate omega-3 supplementation specifically from krill oil because it differs structurally from other sources of omega-3s in that they are primarily bound to phospholipids rather than triglycerides, as in fish oil. This may facilitate the incorporation of omega-3 into tissues more efficiently than fish oil. And Kohler and colleagues in 2015 found evidence for this higher bioavailability after giving 15 people krill oil, fish oil, and krill meal and measured higher EPA and DHA concentrations in the blood of those who ingested krill oil compared to fish oil. So here we have two randomized controlled trials with very similar interventions. They both administered krill oil against a placebo vegetable oil in over 200 adults with mild to moderate knee osteoarthritis throughout 6 months. The biggest difference between these two trials was the dose. Stonehouse and colleagues in 2022 used 4 grams of krill oil per day, whereas Laslett and colleagues in 2021 used only 2 grams per day. And only Stonehouse and colleagues found improvements in knee pain, stiffness, and physical function using 4 grams per day, whereas the trial using 2 grams per day found no significant improvements. Considering how closely matched these interventions are, this leads me to believe that the dosage of krill oil is important in realizing its therapeutic benefits. Now, in another randomized controlled trial by Hill and colleagues in 2023, they investigated the efficacy of a krill oil complex consisting of krill oil, astaxanthin, and hyaluronic acid. Astaxanthin is an antioxidant, a marine carotenoid that gives krill its red pigment, and it may positively influence the biological effects of krill oil by protecting its fatty acids from oxidative damage. So they took 93 participants with mild osteoarthritis and administered either this krill oil complex or a placebo vegetable oil for 3 months and found that joint pain scores were significantly improved in the krill oil group. However, they only used 321 milligrams of krill oil per day, which is much lower than the 4 and even 2 grams in the trials discussed earlier. Now, although astaxanthin is naturally present in krill oil, this study used a ratio that is more than 6 times higher than what is naturally found. And these results suggest to me that krill oil works synergistically with other ingredients to improve the benefits in managing joint pain and confers greater benefits than what would be expected from omega-3 PUFAs on their own. Now, while the benefits of krill oil supplementation appear to be dose-dependent and work synergistically with other ingredients, one should avoid consuming with a shellfish allergy, and we should exercise caution when taking supplements of any kind by looking for products with the natural product number listed on the container. Finally, krill oil supplements are exactly that, and are intended to supplement a balanced diet consisting of whole foods. As such, modifiable diet and lifestyle factors should first be addressed before turning to krill oil supplements as an end-all cure. Thank you.